The dental school started here at the Singapore General Hospital in 1927. It was the first to be established in a British colony in the East. The dental school began with only 3 students and 2 teaching staff. Dr. E.K. Trapman was Professor of Dental Surgery and head of the Dental School of the King Edward VII College of Medicine.
It had a very slow and difficult beginning, as you know. And as I told you earlier, those early years, very few students wanted to do dentistry. As you know, the reason being that dentistry is always second to medicine in the choice of career, for the reason that you know, as a doctor, when you graduate, you get a title doctor, whereas a dentist is addressed as a mister. And another reason is that in those days, there were many unqualified registered dentists practicing in Singapore then, and this somewhat belittled the image of the dental profession. And lastly, it was more expensive to set up a dental practice than a medical practice. And finally, the medical practice had a better financial prospect.
Originally located on the ground floor of Norris Block, the dental school started with just 5 workbenches, a surgery with 3 chairs, an extraction room with an adjacent small recovery room, and an office. In 1938, the new dental school and clinic was established. It was a comprehensive dental school with clinical facilities dedicated to dental teaching and treatment.
Well, the ground floor, I remember, was used for dental surgery and dental and oral surgery. So the conservative treatment that you associate with dentists, filling of teeth and all that, was done at the ground floor level. And the first floor level, where the dental mechanics was done. This was where, the students who were not doing conservative dentistry did the mechanical work which was associated with the setting up, say, of dentures for filling of teeth and all that. They were all done upstairs and then brought down to the surgery downstairs for refitting.
Our dental curriculum is very heavy and tight. You know that in dentistry, you have to complete a schedule of requirement of certain laboratory technique requirement before you can go and treat a patient. And when you're treating patient, you have to do a certain amount of clinical work before you're allowed to sit for the final examination.
I'm certain that the standard of dentistry must have improved tremendously because of the dental school. And it set the standard of what was conservative dentistry in those days. And I think it is setting the standard even of what is happening today. All the good work of the dental school is reflected in what is happening now, how the patients are being treated, both in the dental laboratory here, as well as in dental clinics in Singapore.